you going to be a specialist or you're just going to be a GP? How does one become a general practitioner in Australia? Good day, I'm Tia and I'm a GP in Australia. Today we're talking about how do you become a GP and what's the difference between a GP and a doctor straight out of medical school. So in Australia, you go to medical school first. That might be postgrad entry, as in you've had life before medical school. You might have been a teacher, a physiotherapist, an optician, and then you decided, I want to become a doctor. So that is postgrad entry. Or it could be non-postgrad, direct entry from high school. You decide, I want to be a medic, and you start medical school then from high school. You do your 4-year course, 6-year course completed. By the end of it, you are a medical practitioner. Yay! You then undergo internship, which is an apprenticeship model where you are seeing patients, often in the hospital, with some occasional general practice exposure, but you're largely working under someone's supervision, apprenticeship style. And you keep going in that pattern until you pick whichever specialty you would like. This is different to the US, where after medical school, you already pick a specialty and you go straight into that specialty. In Australia, you are a generalist first. You have general registration, which means you're just a doctor with no extra training, a medical practitioner with no extra training. This is important if you're gonna become a general practitioner because sadly, general practice is still very siloed. I do in my room what I want, and it's not a team-based experience for my patients unless I'm calling a colleague in to say, hey, let's have a look at this rash, or can you think about what I might be missing with this patient? But largely, I'm running the consultation by myself. So that exposure in hospital means that I get to have experience managing pregnant women, managing sick kids, managing chronic illness, heart failure, diabetics, managing old people and young people, managing women, managing men, managing everything in the middle. So you get to develop this experience by being in the hospital. But while you're in the hospital, you're still a medical practitioner, no training, medical practitioner. So there are people who do that and become what we call career medical officers, and their job is that they look after patients. They usually have a boss who they report to, and they do night shifts, they run private hospitals when the specialists have gone to bed, and all that stuff. So there are people who end there. They don't want to commit to one training college. They don't want to commit to one specialty. Or they might have decided to do emergency medicine, but they don't want to go through the hassle of exams and becoming an emergency specialist. So they just work in the emergency department and have a boss and report to someone, and they can get ultra specialized in that niche and just have their life and live their life that way. Or you could decide to become a surgeon, orthopedic surgeon, any other surgeon that you like, or a physician, someone who does not deal with a scalpel. And then you have people who are in the middle, like obstetric gynecologists. They can deal with people, but they can also operate. Then you have general practitioners like me. So you then decide, I want to be a generalist. I want to look after people from cradle to grave. I want to look after men and women. I want to look after he, she, they, them, all the flavors, with them presenting with all the illnesses. General practice is the only specialty where when a patient walks into my building or into my consultation, I have no idea why they're there. In the emergency department, there is a triage system where you go and speak to a nurse and say, hi, I've had a headache or I've had chest pain, and someone triages you and says, Tia, headache. And so when the doctor in the building calls you, they already have a clue that you are coming in to discuss your headache. That's not quite the case in general practice. I could see you today and say, I'll see you in 2 weeks, and you come back in 2 weeks, but something else has happened in the meantime, and that's what we need to talk about. So I don't have a triage system. What I see every day, it's Kinder Surprise, which is fun for me. I enjoy that. And so you train in an apprenticeship model, which means you come into general practice and you start seeing patients, often under the supervision of a senior general practitioner who guides you, who helps you, polish up the history taking, the examination, the management, all the things. Then you write your exams, which involve 2 written papers and 1 oral paper, and you pass. And then you are considered a GP specialist. You've earned fellowship, often with a college, either the College of GPs, RACGP, or the Rural and Remote College, ACRM. I'll link both below. And you become a general practitioner. The goal with your fellowship is that as a college, they are determining you are safe to practice as an independent practitioner. Remember, I said as a general practitioner, you are largely operating in your own consultation, managing patients by yourself. So by passing the fellowship exams, that's what the colleges are saying. You are competent enough to manage patients by yourself, from Melbourne all the way to Birdsville or wherever rural place you might be going. Then you are considered a GP specialist. So don't ask people whether they're gonna still specialize. Yes, you can have a GP who has special interests. Some of my colleagues just do women's health, or they just do skin, or they just do mental health or psychotherapy. It means that a large proportion of their patients fit those special niches that they have picked. I'm still a generalist, so I see cradle to grave medicine, chronic illness, mental health, sexual health, babies, men, women, and she, they, and them, everything. So I also supervise registrars. That means in the room next door, I often have a doctor who is training to become a general practitioner that I might be supervising. That means I might need to step out to consult with them regarding their patients during our consultation. That just needs to happen. Because in an apprenticeship model, I can't have them sitting in with me all the time, and I can't sit in with them all the time. So it's a training wheels kind of training program. General practice training can take 2 years in total if you're doing all the terms, 6-month terms back to back. You can do it part-time though. I hope that all makes sense. And I have inspired you to all be doctors and to all be general practitioners, because a good relationship with a GP is known statistically to increase your life and to give you joy. I certainly do love my patients and I enjoy looking after them. Till next time, see you later. Bye.